Well, it's here. ObamaCare, the Affordable Care Act. Sign up began October 1st. What does it mean for you? What does it mean for you if you're a small business owner or if you work for a small business? What about if you work for a large company? And how will it affect retirees? What will it mean for Medicare and your Social Security benefits? You've got lots of questions. We've got answers on this special edition of Your Money Matters on Talk 107.3 WBRP.
There are plenty of people who believe a safe retirement is too good to be true, that there is no safe place for you to go with your money. Even your very own government will try to tax it right out from under your nose. But you've just tuned in to information that can save your retirement nest egg. It's Your Money Matters, featuring two of America's top retirement specialists, Christy Smith and Matt Kennedy with the Presley Group. They can teach you how to retire without all of the risks. Now, let's get back to Your Money Matters.
And good morning, and welcome to Your Money Matters. I'm Matt Kennedy, agent with the Presley Group. Christy Smith, the owner and founder and president of the Presley Group. She'll be along shortly. Today, we want to take time to really help you understand the Affordable Care Act. There's been so much information out there. It's been a very busy week. Of course, healthcare.gov, the exchange the exchange website has suffered a lot of problems this week, although it looked like toward the end of the week that was beginning to get resolved. But there's so many questions and so many unanswered questions about how the Affordable Care Act is going to impact you. USA Today recently did a survey, and about 53% of Americans surveyed said they were concerned and confused about the Affordable Care Act. Only 24% said they really understood it. So it's safe to say that there are a lot of myths and misunderstandings about the Affordable Care Act, but quite frankly, there are some unknowns as well. Today, we're going to try to help you have a better understanding of how Obamacare is going to impact you. We have two special guests that will be joining us. In this first segment, we're going to speak with a gentleman who is a healthcare reform specialist for Blue Cross Blue Shield. He's going to talk at length about the individual mandate. What do you, as an American, need to know about the Affordable Care Act? Then Christy Smith will be here in segment 2 to talk specifically about how Obamacare is going to impact those of you who are retired or close to retiring. When it comes to Medicare, Medicare Advantage, Medicaid, and Social Security. She'll be here to talk about that with us. And then in segment number 3, we'll talk to someone who can really shed some light on how Obamacare is going to impact those of you who either work for a small business or own a small business. Derrick Babcock with Next Level Solutions is a healthcare reform specialist as well. His real area of focus is how this law impacts small and large businesses, and so we'll have Derrick on to help us with that. Now, before we hear from our first guest, I do want to let you know that coming up on Thursday, October 17th, here in Baton Rouge, the Presley Group is going to have a free educational 90-minute workshop to really delve into Obamacare and answer your questions in detail at this event. It's a free event. It's free to attend. It's October 17th. That's Thursday, October 17th. In Baton Rouge. We'll be right off the I-10, easy to get to. If you will call our office, we just need to get some information so we can get you registered. Feel free to bring a guest or two. It's a great opportunity for you to really get more insight on the Affordable Care Act. Today, we're just going to kind of hit the surface. At this workshop, we're going to go much more in depth. So to sign up, and again, it's free to attend, but to register, simply call us at 791-5773. That's 791-5773, and we'll get you registered for our workshop on October 17th. Now, let's dig into this. Our first guest today is going to really shed some light for you on a broad overview of how Obamacare impacts you directly. Wes Miller is a healthcare reform specialist. He works with Blue Cross Blue Shield and has read all 20,000 pages of the Affordable Care Act. That's something more than most members of Congress can say. And Wes joined us on Talk 107.3 back on Monday, the day before the exchanges opened. and he gave us a really good overview of Obamacare and what you as an individual can expect.
Basically, what's happening is the beginning of the open enrollment period. If you rush out tomorrow and you apply for health insurance, your coverage is not going to start until 1/1 of 2014.
Okay.
So really, there's no need to rush out immediately to get health insurance because you're not going to have coverage, say, next month, unless you're looking for a 2013 product. And if you're looking for a 2013 health insurance product, really what you need to do is contact your health insurance issuer.
Okay.
For the exchanges, what they're designed to do is they're just another avenue for health insurers to be able to provide health insurance to the individual market. And, health insurers have different avenues of selling their products. They have, through an agent or broker, which is the traditional way. There's through internet, e-brokers, and now there's through this health insurance exchange. The difference in what makes the health insurance exchanges unique is that the people applying on the health insurance exchange could possibly get a government subsidy. And there's two different types of subsidies.
Okay.
There's the health insurance premium tax credit, which is to help you pay for your monthly premiums. And there's also the cost sharing reductions subsidy, which helps you pay for your claims costs and things like that. So the one thing to note is that not everyone's going to qualify for these subsidies. For the advanced premium tax credit, is designed for individuals making less than 400% federal poverty level, and the cost-sharing reductions is for individuals making less than 250% of the federal poverty level. So if you make more than that, more than likely you won't qualify for a subsidy.
Wes, let me stop you right there.
Sure.
Just because I want to break it down to where the rubber meets the road. So I'm Matt Kennedy. I work here in part at Guarantee Broadcasting. I have health insurance through Guarantee Broadcasting. There's no need for me to go shop on the exchange, right?
Absolutely not. You have, as long as your employer offers you health insurance, and the health insurance is considered affordable, which is 9.5% of your household income,
or less.
There is no need for you to go out and shop on the insurance exchange. You will automatically be disqualified for any government subsidies.
But if my company's insurance is considered to be not good coverage or expensive, I have the legal right to shop on the exchange, correct?
That's correct. You can go shop on the exchange. Really, anyone can shop on the exchange for individual coverage. The only difference is that you may or may not be eligible for a subsidy. So if it's not affordable and it doesn't meet the criteria set forth by the government, which most major medical health plans do meet the criteria, then you are eligible to go out and see if you qualify for a subsidy.
Now, whether or not you're qualified for a subsidy has no bearing on the fact that you're required to get something.
That's correct. Yeah, the way the 2014 law states is that all individuals will have to have, most individuals will have to have health insurance. There are a few exemptions, but you still have to go to the health insurance marketplace and go through the application process so that it will tell you whether you're exempt or not, and they will give you an exemption certificate. If you decide just to kind of ignore the law and just say, I'm not doing it, you're likely going to face penalties on your 2015 tax return. And the penalties are anywhere from $95 up to 1% of your income. And that's for each individual in your household.
Our guest is Wes Miller, healthcare reform consultant with Blue Cross Blue Shield. Okay, Wes, let's talk about penalties for a moment.
Sure.
If you don't have any insurance and you decide, I'm young, I'm healthy, or I'm a risk taker, I won't bother getting any type of insurance, what kind of penalties do you and your family face?
Well, it's going to determine your family makeup. Really, it's kind of an individual penalty. It's called the individual mandate. So what you're looking at is $95 per adult in the family, up to 1% of your income.
That's in the first year in 2014.
That's for the first year in 2014. If you have any children, their penalty is around $47.50. It's about half of what the adult penalty is for each child not having coverage.
Right.
Now, once 2014 gets out of the way, you will take that penalty on your tax return in 2015, and then for the 2015 year, what you're looking at is $325 per person in the family, up to 2% of your income. And for each child at that point, it would be about $162.50, about half again. And then finally in 2016, it's $695 up to 2.5% of your income. So every year it kind of goes up a little bit more.
But the penalty ends up being a lot less expensive than the insurance unless you have a big subsidy, correct?
That's correct. And in some cases, that's absolutely correct. And that's why we're encouraging, the individuals to go out and get with a health insurance agent. Mm-hmm. Today, more than ever, it is important that you get with an agent because they are really the health experts. They're going to be able to walk you through this process. We've been testing the federally facilitated marketplace now for about 7 days or 8 days, and it is a very complex process to go through. And so you really need someone there to help you walk you through it so that you guys can make the appropriate choice for your particular situation.
Now, for those that are, well, for lack of a better term, hell-bent on ducking this, what is the absolute drop-dead time that they can put it off till as far as not being penalized? Like, if you start 2014 without health insurance, are you penalized, or can you go up to a certain point in 2014 and then just show that you got it?
That's correct. Well, you're required to have health insurance 9 months out of the year. So if you are wanting to wait, the open enrollment period for the first year is from October 1st, which is tomorrow, all the way through March 31st, 2014. If you do not get individual coverage by March 31st, 2014, you will not be able to get coverage unless you have a special enrollment event, which means that if you lose minimum essential coverage at work, or if you have a life-changing event in your family or something like that. So if you are planning to wait, I would make sure that I do not wait any longer than necessary so that I can at least have the coverage for the certain number of months out of the year.
Wes, I want to touch briefly in the minute and a half we have left here on something Jim Donelon said in The Advocate this morning. It costs 12 times as much to insure a 55 to 65-year-old person as it does a young person, like a 25, 35-year-old, okay? However, the Affordable Care Act caps premiums for older adults at 3 times what young people pay. You're in the health insurance business. Is this model even workable if young people don't sign up?
Well, the way the law is set is it's really changing how we deliver, provide, and pay for health care. Insurance is moving away from its traditional definition, which is to incorporate risk assessment, and towards managing medical claims and costs. This is changing the whole game, really, and all of the ACA factors combined for what will change premiums in the future. It's one of those types of things that with anything, there's winners and losers, unfortunately. And by compressing the market to a 3-to-1 market, what you're going to see is the young invincibles, as we call them, will be paying more, while the older generation females generally are going to be paying less. So you're compressing the market to try to get everybody in the middle is what we're trying to do. But the main point is Blue Cross as a company has been here since 1934. We will be here for another 150, 200 years. Our focus is to make sure that we provide health guidance for everyone out there and make sure that we have affordable access to quality care. And that's through providing the extensive networks that we have, the top doctors that we have, the different plan options we have. We have narrow network plans through HMO, and we have broad plans through our PPO products. So we have a variety of products for everyone. So we just want to make sure that we provide the products necessary for you.
Wes Miller from Blue Cross Blue Shield, and their website is loaded with information. Visit bcbsla.com/health reform. That's BCBSLA for Blue Cross Blue Shield, Louisiana, bcbsla.com/health reform, and there's so much information there. There's PDFs you can print out and much more. Now, if you want to learn more about the Affordable Care Act, again, we want to invite you to our free workshop coming up October 17th. I'll be hosting this along with Christy Smith. We'll have a chance to really dig deeper into the Affordable Care Act and talk specifically about how it may impact you, your business, etc. This workshop is coming up October 17th, 6:30 p.m. in Baton Rouge, just off the I-10 around the College Drive area. Easy to get to, and again, there's no cost to attend, but we do need your name so we can have a head count. So please call us at 791-5773. That's 791-5773 to register. If you're outside of the Baton Rouge area, area code is 225-791-5773. Someone's in the office, and they'll take your name and information. And we would love to see you on the 17th at this workshop that specifically digs into the Affordable Care Act. Now, when we come back in a moment, Christy Smith will join me. We're going to talk about seniors, how the Affordable Care Act is going to impact Medicare Advantage programs. We'll also talk about any impacts on Social Security benefits and how you should prepare going forward now that the Affordable Care Act is here. Plus, in our third segment, we'll talk about the impact on small business with a small business expert. It's all coming up on this special Affordable Care Act edition of Your Money Matters on Talk 107.3, presented by the Presley Group. Presented by the Presley Group. I'm Matt Kennedy. We just heard from Wes Miller, health reform specialist with Blue Cross Blue Shield. Got great insight from him. Coming up next segment, we're going to hear from someone who really understands how Obamacare will impact businesses large and small. But joining me now is Christy Smith. And Christy, of course, the owner, founder, and president of the Presley Group. Christy, it's great to know how it's going to impact the small business owner, the large business owner, and the individual person. But as retirement specialist, of course, our big concern is what impact is it going to have on those retired or those who are just about to retire? And I know we really want to talk about that for a while.
Well, first of all, I think that we're going to see an impact on Social Security recipients, those that are on Medicare. The reason why we're going to see that is because I believe we'll start to see a shift in Medicare Part B premiums. In the past, Medicare Part B premiums were a level premium for everyone, but several years back they went in and actually imposed a means-tested program for Medicare recipients. But what we're going to see in the future, in my opinion, is we're going to see a rise in Medicare Part B premiums.
Can you talk about means testing? That's a word we just throw out. But for someone who says, whoa, what does she mean, means testing? What do you mean, Christy, when you say it's means tested?
Well, in the past, everyone had a level payment. Everyone that signed up for Medicare Part B had to pay the same exact premium to have that benefit. But several years back, the law was changed, and in fact now, if you make above a certain income level, your Medicare Part B premium is higher for the same coverage that someone that has a lower income may be paying. And we expect that premium to continue to rise. One of the biggest factors that we see that's going to impact this is that with the Affordable Health Care Act, we're shifting more of the services away from Medicare Part A and throwing them into Medicare Part B because we're going to see more and more people treated as an outpatient. Things that used to be done in the hospital are now being done at your doctor's office.
Right.
And so we believe that Medicare Part B premium is going to rise in the future. But not only do we have to be concerned about the Medicare Part B premiums rising, but we also have to be concerned about the Medicare Advantage plans. And the Medicare Advantage plans have been really a blessing, in my opinion, to many seniors in our area, including my own family. But those programs are going to start receiving less funds to take care of each individual Medicare recipient. And so what that's going to ultimately mean is it's going to mean that the Medicare Advantage plans will turn around and increase payments and co-insurance costs to the actual consumer. And so I don't think that we have a huge impact right now as far as 2014, but I think in the future we're going to see a lot more of that. We're going to see rising health care costs. Now, I will say that one of the advantages to the Affordable Health Care Act is because there is going to be affordable health care offered to everyone and there is no pre-existing condition period, I believe we're going to start to see people retire a little younger than they would in the past.
I think that's a great point. I really do. Before we move into that, I want you to know, folks, though, that when Christy talks about means testing, part of the 2014 budget battle is a change in the means testing so that those making over $250,000 a year as a retired couple would see a fairly significant rise in the amount they've got to pay. And so you're absolutely right. The means testing on that is changing. But to the point you just made, Christy, it's so important. We can't stress this enough. Under the Affordable Care Act, you cannot, beginning in January of 2014, you can't be turned down for a pre-existing condition. And, Christy, I know a lot of people will stay at a job until age 65 for one primary reason. That way they know they have health insurance until they can jump on Medicare, correct?
That is correct, Matt. The thing is, it even goes a little deeper than that because many of your large companies will offer the employee to continue their health care coverage, but they'll have to convert to the COBRA plan if they retire before age 65.
Correct.
And we all know that the COBRA plans tend to be very expensive.
Very expensive, right.
And then a major concern is, when you have a married couple where, say, the husband is 3 or 4 years older than the wife. So we tend to see a gap in coverage, and so a lot of times people are forced to work until they're 65 because they want to make sure that not only they have health insurance, but their spouses as well. But with the Affordable Health Care Act, no one is going to be able to be denied coverage.
So let's give you an example. What that means is if someone who is 61 years of age decides I'm going to retire early, or 58 years of age, if you wanted to retire early, you could do that, Christy, without having to fear not being able to get health insurance, because then you would go and shop on the healthcare exchanges through healthcare.gov without the fear that there's going to be some delay because of a pre-existing condition. Now, you won't have a company there to offset the cost, but if your income is low enough, then the subsidy would certainly offset a lot of the cost. And, Christy, I wouldn't be surprised if we didn't see a lot of younger baby boomers retiring and moving on to maybe self-employment or something like that, because under the Affordable Care Act, one of the major provisions is that by law, insurance companies will not be allowed to charge 55 to 65-year-olds more than 3 times the most expensive premium for a young person. Now, the actuarial tables say that an older person is 10 to 12 times more expensive to insure, but by law, they can't be charged more than 3 times as much if they're shopping for an individual plan through the exchange. We may see a lot of early retirement, huh?
I believe we will. And not only will we see earlier retirement, but we may see a lot of 60 to 65-year-olds entering back into the work system. In the past, someone that retired at 61 was hesitant to try to find another job between 61 and 65 because they were concerned that maybe they wouldn't be able to find a job. Mm-hmm. And obviously one of the big reasons for that is because big businesses don't want to have to spend as much on health care. When they're hiring employees that are in their 60s, they in the past understood that they would be taking a chance of rating up their entire group. But now they're not able to do that. And so you may see someone that's 61 years old retire from their job, go onto the health exchange or the marketplace and buy their own individual plans. And you may see them going in and work for companies now as a contract worker versus a W-2 employee.
That's a great point, because as a contract worker, you could just hop on the exchange and buy your insurance there. We're going to talk more in our next segment with Derrick Babcock, and he's going to break down for us more of what business owners need to know. But we want to tell you that we have a major workshop coming up on Thursday, October 17th, 6:30 p.m. in the heart of Baton Rouge, just off the I-10. We are going to spend 90 minutes to maybe even 2 hours really breaking this down in much more detail. We've got a fancy-smancy slideshow and all of that. If you would like to register for this workshop so we can really delve much deeper than we can here on the radio into the Affordable Care Act, simply call us. It's free to attend, 791-5773. That's 791-5773. If you're outside of the Baton Rouge area, it's area code 225-791-5773. Call the office or send us a message through the website, safemoneyplan.net, and we'll make sure you're registered for the event on Thursday, October 17th. Now, while we can spend hours, Christy, breaking down the Affordable Care Act, when it comes to people who are close to retiring or who are already retired, they may be saying, what does this matter to me? I mean, it's not going to really affect Medicare that much. It's not going to really affect Social Security that much. I'm working for a company. My insurance is through them. So many may be asking right now, Christy, why is this going to impact me?
Well, the first reason it would impact them is that we expect to see rising health care costs. But the majority of the concern really should be laid in the fact that our country has now taken on another program that they have to fund. We're already at a $17 trillion deficit. We're renegotiating the debt ceiling right now. In the next couple of weeks, we're going to see our government have to make a decision on that.
Correct.
And when we see high debt, we typically see high taxes or higher taxes and higher inflation. And so there's many reasons why we as individuals need to be concerned about our retirement money. If anything, we should be more concerned about our retirement money now than we ever have been in the past. Not only do we see all these concerns with rising taxes, rising inflation, rising health care costs, but we also see that we're living longer. So instead of planning on living in retirement for 10, 15 years, we have to plan on living in retirement sometimes 20 to 30 years.
Yeah, the average person, this is a stunning statistic, the average person now spends 27 years in retirement. So the question for you is, with all of this uncertainty out there, debt ceiling talk, how will Obamacare impact the economy? What's it going to mean with the government having to take on coming up with money for these subsidies? All this uncertainty is driving Wall Street bananas. How will you know that you have enough money to last during retirement? How will you know that a stock market downturn isn't going to hurt you? Christy, our slogan is financial security in any economy, including the economy post-Obamacare, correct?
Correct. And those of you who are approaching retirement, maybe you're still working at your job, but you're over 59 and a half, now might be the perfect opportunity for you to sit down and look at the option of processing an in-service distribution. We can all remember back to 2008 and what happened to our retirement accounts. If you're close to retirement, really within 5 years from retirement, you may have the option to use an in-service distribution. And I believe now it's more important than ever that we take the time to evaluate, how are we going to create this income that we're going to need during retirement? I mean, the market is very unstable. The last year has been good. Our clients have made good money. Many of you listening today have made good money. But the reality is that, Wall Street is somewhat predictable. It runs in cycles, and it never stays at a high. And so most of us are just kind of bracing for when is it going to give. Right now we're seeing a downturn in the market because of the uncertainty with the government shutdown, the renegotiation of the debt ceiling. There's many factors to what's going on in Wall Street right now, but this doesn't mean this is definitely the big downturn that a lot of your economists have predicted. I think now is certainly a time to somewhat plan and prepare so that if we do see a real major downturn, you're not faced with having to work another 5 years to overcome the losses you've sustained in your retirement account.
People right now are scratching their head trying to figure out two things, Christy. Trying to figure out Obamacare, but also trying to figure out what impact is all of this political wrangling going to have on the economy. And right now it seems like Washington is doing more damage to people's portfolios than what's actually happening in the market.
I would agree. Wall Street is uncertain right now.
Yeah.
We all know that Wall Street doesn't like uncertainty. There's definitely a lot of uncertainty. Jobs, we still have relatively high unemployment. There's so many things we could go on about why you need to plan and protect for your retirement, but the biggest gift you can give to yourself, think about it. You buy presents for your family, for birthdays, for Christmas, Easter. Give yourself a gift. Give yourself the gift of peace of mind. Our clients have not had to spend one night sleepless because they're worried about their retirement income. And that's what our fixed index annuity strategies do, is they give you that security. They give you that stability, consistency. And while many of you may think Christy and Matt like it when the market goes down, they're fear mongers. We're not fear mongers. We actually like it when the market goes up. Our clients have made very good money this year, and it makes us excited when they walk in the door and we're able to tell them that. But the reality is our products do become more valuable in a downturn.
That's right.
That's because that's when people really feel the pain, and we can eliminate that using our fixed index annuity strategies. And so, it just takes one step. You need to pick up the phone, give us a call, and say, hey, I want to come in for that complimentary visit. We can sit down and talk. We're not going to twist your arm. We're simply going to talk about how can we help you solve a problem. Our office number is 791-5773. And don't forget, we've got that workshop coming up, really, really going to dig deep into the Affordable Health Care Act, known as Obamacare. That's going to be on October 17th here in Baton Rouge. It is truly an educational workshop. If you'd like to attend that event, give us a call at 791-5773. It is free, but seats are limited, so you do need to give us a call as soon as possible. 791-5773.
When we come back, Derrick Babcock, who is a healthcare reform specialist and a consultant to business owners, is going to spend some time breaking down for us how the Affordable Care Act is going to impact businesses, both small businesses and large businesses. That's next as we continue with more of Your Money Matters here on Talk 107.3 WBRP.
How will Obamacare impact you? What will it mean for your retirement? How will it impact your business? This is Christy Smith from the Presley Group, inviting you and a guest to a free workshop on Thursday, October 17th at 6:30 p.m. in Baton Rouge. It's not what the government is going to do for you. It's what the government is going to do to you. To register, call 791-5773. Seating is free but limited. Call 791-5773.
And we continue on Your Money Matters here on Talk 107.3 WBRP. Your Money Matters presented by the Presley Group. Financial security in any economy. Our website, by the way, is safemoneyplan.net. So far today, we've heard from Wes Miller from Blue Cross Blue Shield. Wes gave us a great breakdown at the beginning of the show on the Affordable Care Act and its impact primarily on us as individuals. Of course, Christy was here to talk about the impact on retirees. Now let's take some time and focus on how the Affordable Care Act impacts you as a boss, you as a business owner, or maybe you work in the HR department for a large company that employs more than 50 employers. This is where the Affordable Care Act, quite frankly, gets very, very complicated. So earlier this week, myself and Brian Haldane had the chance to speak to Derrick Babcock. He, like Wes Miller, really understands the Affordable Care Act. Now, Derrick's area of expertise is how the Affordable Care Act impacts businesses, large and small. He is a consultant with Next Level Solutions here in Baton Rouge. Their website is nextlevelsol.net, Next Level Solutions. And we spoke with Derrick, again, earlier this week, talking about the impact of the Affordable Care Act on businesses. So, Derrick, what are the most important things that business owners, business operators need to know right now?
Well, there's a number of things that they need to consider, especially if they're at the 50 employees or more. It's a very real concern, and for a lot of these business owners that I've talked to, I've told them your best friend today is your insurance broker, and that's because these guys, they're out there running their business, doing their thing that they know how to do. They don't have time to sit down and try to figure all of this out. And so that's what we do as consultants and brokers for health insurance.
Because I know a lot of small business owners, we'll focus on large businesses in a moment. A lot of small business owners, they're just confused. They don't know what they need to do. So assuming that there is no 1-year delay on the individual mandate, let's say I own Matt's rug shampooing service, and I've got 7 people working for me. What do I have to do?
Yeah. Well, as a small business owner, under 50, you're actually in pretty good shape. The mandates really aren't going to apply to you when this comes in 2015. So as far as the under 50 goes, there's not a whole lot that you really got to worry about. There was a letter that was supposed to come out October 1st, and that letter is still out there. It's just basically a notification of the healthcare reform exchanges that are opening October 1st. That letter, September 11th, they passed a law that said it is no longer required. However, it is considered prudent to still distribute that letter. So
this is a letter of notice then?
It is, okay. Right. And so regardless of the size of your company, whether you offer benefits or not, you're going to be required to send that letter out. That is no longer required.
Okay, that's good. One less piece of paper. Now, let me ask you this.
Sure.
In my business with my 7 employees, if I presently offer them health insurance, I've got 2 options, right, Derek? I can stop offering them health insurance and let them go to the exchange, or I, as the small business owner, will be able to use the exchange to help them get insurance and get myself a tax credit as the small business owner, correct?
That's correct. There's what's called the shop, and there are a lot of factors that go into the shop exchange, but depending on the size of your company, average wages, things like that, there would be some exchange credits that are available, and that's something you definitely want to get with your broker or consultant about to try to figure those out. It's sort of a complicated formula, but for a lot of small businesses, there would be the shop available for things like that.
Do you think a lot of small business owners are going to stop giving their employees health care coverage and just let them go to the exchange? Do you think we're going to see a lot of that?
At this point, a lot of the companies that I've talked to, health insurance is one of those benefits that they use to recruit good talent. And so I haven't seen that. Now, that's not to say that in the future they wouldn't trend that direction. But as of today, the companies and business owners that I'm talking to would like to go ahead and still maintain that coverage.
And what about the possible trend of devising a new package that covers it without covering it, so that they're out of the insurance business and they're small business, and yet still staying compliant with everything?
You're talking about the defined contributions, basically giving them
yes,
money. Yeah, that's something that is a lot of people are talking about. There's some questions as far as COBRA laws, ERISA, things like that, whether you can do that or not.
Right.
It is something that people are considering. I've had a lot of questions about. We're looking into, and so we'll see. I mean, that's in today's world. It's not a big factor, but it is something that I see on the horizon. I've told a lot of my business owners, to keep an eye on something like that, potentially just to basically predict costs better and still provide the benefits to their employees. So.
Derrick Babcock with Next Level Solutions with us. Their website is nextlevelsol.net. All right, let's talk about businesses that have more than 50 employees. They absolutely have to start doing a lot of work, don't they?
They do. And I've got a lot of companies who are looking at breaching that 50 mark, and I've told them, I said, look, I always encourage you to grow your business, but it is a new world once we do. And that's not a bad thing. It's just that we've got to consider things a little bit differently, and health insurance primarily. When this thing first came out, a lot of companies said, well, it's cheaper for me just to drop benefits and pay the penalty, the $2,000 per employee. And actually, a lot of the scenarios that we have run, we have not found that to be the case. It has been still more cost-effective for the employer to provide the health insurance benefits.
Can you clarify one thing for me, Derek?
Yeah.
I understand that it's $2,500 fine per employee if you don't provide them health insurance, correct?
If you don't provide them, it's $2,000 per employee. It's basically, if you cross that 50, then they are going to subtract the first 30 and charge you $2,000 per employee.
That was my question. Why the first 30?
Specifically, why they came up with 30, I don't know. But that's how they calculate this formula. They take the number of employees over 50, subtract the first 30,
okay,
multiply it times 2,000.
Now, one of the big questions that full-time employees, that companies larger than 50 people, one of the big questions they have, Derek, is, okay, what constitutes a full-time employee? Can you take us through the new rules on what constitutes a full-time worker?
I can do that. So a full-time worker is any employee who works 30 hours or more per week. But you have another factor that comes into that, and that is full-time equivalents when they're calculating the 50. And so that may be a part-time employee that's working 25 hours per week, but they're going to take all of your part-time hours, add those up for each month individually, and then divide that by 120.
Oh, Lord.
And so now those employees, they may count towards your what they call ALE, which is an accrued large employer, meaning you must provide benefits, but you don't necessarily have to provide benefits to those employees that are under 30. So they may put you over that line, but you don't have to provide benefits for those. So I'll tell you, one of the main conversations that I've had with a lot of employers, and this has subsided since they decided to delay this mandate, but is how do I control my costs? How do I cut back hours? How do I cut back the number I have? And so, that was a real concern, and I know there was a lot of talk in the media, but real-life conversations that I have had with business owners has been exactly that. How do I control my costs? And that's by cutting hours, cutting employees.
Yeah. Our thanks to Derrick Babcock with Next Level Solutions here in town. Their website is nextlevelsol.net. We appreciate his expertise as it relates to those of you who own businesses or maybe are HR managers inside of large companies. There's a lot to absorb with the Affordable Care Act. And coming up October 17th, we would welcome you and a guest to join us in Baton Rouge, 6:30 p.m., for about a 90-minute workshop with much more detail. We're going to have the time to kind of dig into more of the nuances of what this means for the individual, what it means for the retiree, what it means for the business owner, the small business owner especially. This workshop, again, is free and open to the public. We simply ask that you call to reserve a space. Our number is 791-5773. That's 791-5773. October 17th, beginning at 6:30 p.m. Lots of good information. We would love to have you attend. 791-5773. We've already heard from some business owners down in New Orleans who want to come up and learn more. We welcome you there as well. 791-5773 to register for our event on October 17th. Back with more of Your Money Matters in just a moment. And welcome back, closing segment of Your Money Matters. Well, we have focused a good bit this morning on the Affordable Care Act, and we hope we've answered some questions for you. Of course, you can always reach out to us via phone at 791-5773 or on the website, safemoneyplan.net. If we can answer more questions about the Affordable Care Act, and we are having that workshop October 17th, 6:30 p.m. To answer even more of your questions, to register, call us at 791-5773. And all this week, of course, much of the focus has been on the opening of the exchanges and the Affordable Care Act. But, of course, the other big focus has been on the partial government shutdown. You've got Republicans pointing at Democrats, Democrats pointing at Republicans. And you know who's stuck in the middle? Us, the American people. Wall Street doesn't like uncertainty, and we've seen that this week. Now, the markets did bounce back some on Friday, but for much of the week, the markets were heading south. And there's another big issue on the horizon. Coming up October 17th, we hit the debt ceiling. And the United States has in the past many times raised the debt ceiling, and there's no reason to think they won't do it again, but will we see another, two rams butting heads on the issue of the debt ceiling? Timothy Geithner, Treasury Secretary, warns that if the debt ceiling isn't raised, the U.S. will start defaulting on payments and debt, and it could be catastrophic for the markets and the economy. But again, you've got political factions warring here, and we are stuck in the middle. So I ask, what's your plan? If you're already retired, are you comfortable having your money bounce up and down in this market? If you're planning for retirement, close to retirement, do you want politicians controlling your future? Because I hate to be so blunt, but that's kind of what we have right now. A situation where gamesmanship on the Hill means ups and downs for your portfolio. Some economists say, look, once they get this all worked out, the market's going to be fine and we're going to have a great 2014. Others, well, different opinion. They're not so positive. But no matter what the future holds, are you prepared to protect and preserve at least a part of your retirement nest egg? There's so much uncertainty over the budget battle. There's so much uncertainty over raising the debt ceiling. And of course, there's so much uncertainty over the impact of the Affordable Care Act. How do you guard yourself against that uncertainty? You start by sitting down with one of us from the Presley Group and talking about how you can achieve financial security in any economy. That's not just some slogan we just throw out there. For the past 16 years, Christy Smith has been helping people just like you, over 800 different clients who have learned that when the market is going up, they share in those gains and make money. Interest is earned and locked in on an annual basis in our accounts. But when the market heads south and turmoil on Capitol Hill erupts and the stock market goes down, our clients don't suffer losses due to market conditions. How would it feel knowing that you're in a program that when the market's good, you share in gains. When the market's bad, you're protected from losses? That's what we do at the Presley Group. You can learn more by calling us and setting up a free, no-obligation one-on-one appointment. 791-5773 is the number, 791-5773. If you keep doing things the way you've always done, you're always going to end up with the same result. So if you keep riding the roller coaster of Wall Street, then you're going to remain subject to the whims of someone else's decisions. We want to help you take control of your retirement future. So give us a call and set up that free one-on-one consultation. You know, one of the first things you'll discover about the Presley Group, one of the things that makes us different is we listen. On that first visit, we sit down and we listen. We listen to your fears, your hopes, your goals, your dreams, your aspirations, and your concerns. So call us at 791-5773. Let us teach you about our fixed indexed annuity products that in this uncertain economy can give you peace of mind knowing you're not going to lose your money when the market goes down, and you'll share in those gains when the market rises, and we can even help you create guaranteed retirement income. Again, our number is 791-5773. That's 791-5773. You can also reach us online at safemoneyplan.net. That's safemoneyplan.net. And don't forget our workshop, our Affordable Care Act workshop on October 17th. To register for that, call 791-5773.